Good evening, folks. This is C for you. We're discussing a article from Nature Mental Health. Okay, emphasizes the vital importance of measuring well-being in mental health research and treatment. Here are the key points. Main takeaways. Beyond symptom reduction, well-being is more than just the absence of mental illness. It plays a crucial role in resilience, recovery, and overall quality of life. Research gaps. Despite its significance, well being is often neglected in clinical studies and treatment evaluations. Measurement challenges. The study identifies inconsistencies in how well being is assessed, which hampers its integration into research. Recommendations. Researchers advocate for standardized, reliable methods to measure well-being, enabling more holistic mental health care. Clinical implications, including well-being matrix in trials and treatments, can lead to better patient outcomes and a deeper understanding of mental health. The study was led by Fulton Goodman at George Washington University and published in Nature Mental Health 2025. Would you like to explore how these insights could be applied to frailty aware or memory friendly care models? Great question, Felicia. Measuring well being in practice involves both subjective and objective tools that capture how people feel and function. Here are some widely used examples across different domains. Subjective well being measures. These rely on individuals' self reports and are often used in surveys or clinical settings. Who's Who 5 Well-Being Index, a short questionnaire developed by the World Health Organization to assess emotional well-being. PERMA Profiler, based on Sigmund's positive psychology framework, measures positive emotion, engagement, and relationships, meaning, and accomplishment. Satisfaction with Life Scale, SWLS, evaluates global life satisfaction through 5 statements related by the individual. Rated by the individual. Wunrich Edinburgh Mental Well-Being Scale, or WEMS, focuses on positive mental health, including optimism, energy, and clear thinking. Objective well-being indicators. These look at external factors that influence well-being. Employment status, whether someone has stable work, housing security, access to safe and stable living conditions, education and income levels, often used in public health and policy evaluations. Environmental quality includes access to green spaces, clean air, and noise levels. Hybrid approaches. Some frameworks combine both types. OECD Well-Being Framework integrates subjective life satisfaction with objective indicators like health, education, and civic engagement. Harvard's Flourishing Index measures domains like happiness, meaning, and character and social relationships. Would you like to explore how these could be adapted for memory-friendly housing or frailty-aware care models that could help sketch out a tailored framework? Excellent question. While well-being measures are essential for holistic mental health care, they come with notable limitations that can affect their reliability, inclusivity, and practical application. Here's a breakdown. Conceptual limitations. Lack of consensus. There is no universally agreed definition of well-being. Some frameworks emphasize happiness, hedonic. Others focus on meaning and purpose, endronomic, and many blend both. Cultural bias. Most validated scales are developed in Western contexts, which may not translate well across cultures or marginalized populations. Overgeneralization. Some tools lump diverse domains, e.g., physical, emotional, spiritual, into single score, obscuring nonsense insights. Measurement challenges. Subjectively, self-report tools can be influenced by mood, social desirability, or influenced by mood, social desirability, or misunderstanding of questions. Inconsistent use. Different studies use different scales, making comparisons difficult and limiting. Meta-analysis. Statistic snapshot. Many tools capture well-being at a single point in time, missing fluctuations or long-term trends. Practical constraints. Okay. Time and resource intensive. Comprehensive assessments may be too long or complex for routine clinical use. Limited integration. Well-being metrics are often siloed from diagnostic or treatment protocols, reducing their impact on care decisions. Policy disconnect. Measures may not align with policy frameworks or funding models, making systematic adoption difficult. Would you like to co-design a well-being assessment model tailored for frailty-aware or memory-friendly environments? We could build in cultural responsiveness, dynamic tracking, and therapeutic relevance. Cultural bias can significantly affect how well-being is measured and interpreted, especially when tools developed in one context are applied to another. Here is a breakdown of the key issues. Conceptual bias. Western-centric definitions. Many well-being measures emphasize individual happiness, autonomy, and achievement. Values common in Western educated, industrialized, rich, and democratic, weird societies. Neglect of communal values. In collectiveness cultures, well-being may be more closely tied to family harmony, spiritual fragment, fulfillment, or social obligation, which aren't captured by standardized scales. methodological biases, survey framing, questions like how happy are you may not resonate universally. Some cultures may avoid self-praise or interpret happiness differently. Translation issues, linguistic nonsense can distort meaning when scales are translated, leading to inaccurate responses or misinterpretations. Policy and practice implications, misguided comparisons. Global happiness ranks often overlook cultural invalidation in how people conceptualize and express their well-being. In corporate interventions, using culturally mismatched matrix can lead to interventions that fail to address what truly matters to a population. Solutions and innovations. Participatory frameworks involving communities in defining and measuring well-being helps ensure relevance and accuracy. Contextual adaptation. Tailoring tools to reflect local values, language, and lived experiences improves validity and inclusivity. Would you like to explore how to build a culturally responsive well-being framework? For memory-friendly or frailty-aware care environments, we could integrate spiritual, relational, and environmental dimensions that reflect diverse aging experiences. Here are some compelling examples of culturally responsive well-being measures that aim to reflect diverse values, lived experiences, and social contexts. Participatory and community-based frameworks. Australian Aboriginal social and emotional well-being framework emphasizes connection to land, culture, and spirituality, ancestry, and community domains, often overlooked in Western models. Where to Tapa, New Zealand model. A holistic health model with 4 pillars: physical, spiritual, and family. Widely used in Missouri health services and education. Urban-based assessments. Rooted in the philosophy of interconnectedness and communal harmony, these tools prioritize relational well-being and collective identity. Includes culturally adapted versions for over 20 countries, allowing for localized interpretations of domains like environmental, social relationships, and psychological health. Gallup World Polls Wellbeing Index. Through global, it incorporates region-specific questions and benchmarks to reflect cultural validation in life, satisfaction, and purpose. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. Until then, Gator Wellness, take care, folks.